The Wound Care Services first came together in 2021 to co-produce and improve wound care services across the 3 partnership organisations. It was at this time that we were successful in becoming a tranche site for the National Wound Care Strategy, and we are rolling out the lower limb recommendations. The clinical leads and a strong programme manager alongside nursing director have forged a strong working group, and together we have collaborated on many work streams. We attempt not to duplicate, and we share our knowledge for the end benefit of our patients. One of our initial pieces of work were for the clinicians to come together to develop an MSE-wide wound care formulary. We're very proud of this piece of work. We've been trialling a wound management digital solution. This app enables healthcare professionals to digitally scan wounds, obtain accurate wound measurements and tissue redistribution.
That helps with the engagement with the patient and helps promote them to engage in the healing of the wound. Because you have that live photos of the history as a PDF, you can show them the history of the wound. And what patients like is that they can see that the wound's healing, so hopefully they'll be more compliant with the regime that we're setting up, and that will give them a little bit more positivity and boost their morale.
With a strong senior nurse lead on board, Rosina Wolf, and a champion nurse at the base, Kirsty Bremner, and a super user, Louisa Eigenbar, the Canvey district nurses have almost doubled the number of scans taken in total within a 3-month period. As such, Essex Partnership University Trust is one of the top 3 users nationally.
I have found that it makes watching how the wound progresses much easier, because when you're in the patient's house you can see if that dressing has done anything in that time, and you can make a decision there and then as to what you're going to do next.
Special thanks goes out to South East and South West Podiatry and all of the community wound care teams across the organisation. They've engaged with the app since the start, and their ongoing feedback and support has meant that we can continue to evaluate the effectiveness of the app and what it brings to the wound care arena.